are looking for a knot, and we have to now discuss what is a knot. Really, what's a knot? Is it something objective? Ah, that's a knot, it's half an inch size, or it's something subjective?
Subjective.
It is subjective. Sometimes you will find an area that feels knotty, which means hard, but then it's nothing. You press, no tenderness, no tension.
Just thinking, some people have deposits of fat in
Yes.
their skin as well,
Yeah.
and they can feel like there's something there, and actually it's
It's
just
nothing.
extra fat hanging out in the tissue.
Yeah,
So
in a circular way.
Yeah.
So it's more like, oh, you feel like a lump there. It's fat. So
don't tell them that.
it's a no. It's a. Some people move it, some people remove it, sometimes not. It's a benign. Which means it's not dangerous. It's just a growth of a capsule. It's a fat in capsule. So
It's called, is it
Right.
lipoma?
lipoma, yeah.
They can get quite large.
So you want to go deep. So first thing, what Jet suggested, you improve the blood circulation. Yeah. What else? When you do deep pressure, how else would it help?
Flushing out toxins.
Sorry?
Flushing out toxins.
Flushing out toxins, yes? So through the blood circulation, right? So let's say there is a lack of blood circulation there, and you pump blood by reducing. It's like sponge, right? If you have a sponge that is quite tight, if you start moving in and out the fluid, and if you're squeezing it and increasing it, yeah. Give a better example. Let's say you have some. Do you know when you're painting, you have paint on a sponge, or if you're washing dishes and you know the detergent stay there, what you need to do is you can put it in water and it just goes out, or you squeeze it, put more new water, squeeze it, new water until it's clean. So that squeezing in and out help in the circulation onto that area. Yeah? So it does help in bringing fresh blood, taking away all the toxins with the blood that drained.
How many times should we be doing it on the same spot?
Don't know. Sometimes
Might
5
get
massage hours, that would be sometimes 5 minutes, depends on how their response to it. What else?
Bring oxygen.
Sorry?
Bring oxygen.
Yeah, all the with the circulation.
So obviously it's going to release the muscle tone and the contraction of the muscle
Yeah.
and warm it up.
How?
And,
Let's think about the process of that sponge from being tight, relaxed when you're working on it. How does it happen?
Breaking tissues. Like, if there's scar tissue. No, it's made the wrong expression. When it's scar tissue,
Yes.
so when you're doing pumping.
Elongate.
Yeah,
Elongate.
It's like
Okay.
you're ironing it out or something.
So you can elongate it, right? Say stretch it. So you elongate it and maybe relax. Actually, it's the opposite of the other pump. When you're pressing and relaxing, now you can do stretching and relaxing, stretching and relaxing. So you can do that, and it elongates the collagen fiber, the connective tissue. Yeah? How else you can help to relax with putting compression onto the... You're right, you are relaxing it. Think about the brain and sympathetic, parasympathetic nervous system. If you have an area that is in pain and you introducing different sensation to that area, the pain subside, then tension subside, because the person is more relaxed now. Yeah, it was cold hands situation. You know, when you're having cold hands, it's another example. When you start massaging with cold hands, the client's body get into shock. So if you start doing movement, you're taking the cold away, because the body can feel only one sensation, and that sensation would be the movement. Then no, it's not cold anymore. Same thing in here. You have tension, you have maybe an ache. So when you do pressure, that would reduce the nerve into that area by saying, okay, now you relax. I help you to relax. It goes to the brain. The brain sends less motor signal. It relaxes. Yeah? And also with the parasympathetic nervous system. The more you relax, the less pain you have. Muscle tone improve, and even blood circulation improve because now muscle tone is relaxed.
It's going to add in terms of the client, if you find those areas, then they feel like you know where their pain is. So again, another level is the psychological level, is they feel safe,
Absolutely.
they let go more because
Yeah.
this person knows where the pain is.
Yeah, definitely. You anticipate for them. You know where the ache is. Yeah. So shall we give it a try?
No,
Or
it's
question? Yes, question before.
When I did Tamsin, I realised she had quite a tense area here. And I was thinking about, I did compression once, but then I realised there's lots of blood, big blood, like arteries going here.
Mm-hmm.
So I wasn't sure if I dared to do much. I did once, I think once.
Mm-hmm.
I didn't dare do more because I could feel like it was,
Not in the right place. Yes. Actually, this area, it's called the cubital area. It's kind of, you know. Would you go into your elbow with it? Or
No.
maybe not. Yeah. So it's you know, it's quite vulnerable. Yes, and there are arteries here and nerves. So it's interesting because you didn't know, but it's not an area that you usually go deep
Yeah.
into.
because she was really tense.
Yeah.
But
So what you could do maybe is less pressing on that area, but more flex their elbow and working on the side of it. Rather than pressing down, work on the side of it. Yeah? To not pressing down. Yeah.
I always say if you increase the surface area, if you've got a smaller area, it can be a bit pokey. So
Yeah.
you can use, maybe use the side of your hand and press at an angle rather than
With the
getting
with the
right
fo-
in there.
with the thumb, yeah.
Mm.
Yeah. Because there is an element of pokiness there, isn't it? Yeah.
Potential pokiness.
Yes. Claire.
No, what's friction as well again?
Sorry. Friction. Okay. Friction. So far we've talked on a compression technique, but actually is correct also for an elbow technique. Yes. If you have like gluteus maximus here, it's the same thing. It's a compression with the elbow. Yeah. Now, what is a friction? Friction, there are two ways to look at it. Either, if this is the skin, you create friction on the skin, yeah, like warming it up, yeah, or you can do the compression with a little bit of deeper movement. So instead of being very static, you're moving it and you feel frictioning all the muscle fiber. The two ways to look at it. So I would say for me friction, but it's not important, is more that movement, and that is more of a compression with movement.
Yeah.
Yeah.
Okay.
Take it but just if you see it somewhere else, it's sometimes unclear.
Joel,
Yes.
the compression, is there any areas that you shouldn't actually do compression on the back or like?
Yes. Yes. I think that what we'll do, maybe we'll take it into two demonstrations. First, we'll revise the compression itself as a technique. Then, what we'll do, and I'll ask you to do it, then we'll travel around the body and feel what is it to do compression there? What is it to do compression? And maybe start to identify where it feels good, where it's too much, where you have to be cautious. Because you don't want to do that technique when in an area that feels too painful. Yeah?
What do you know when you get a really big knot,
Yes.
is it alright to use the heel of your hand to
Yeah.
compress?
Yeah. So we can talk about, or maybe I can ask you, what is the difference between a knot or an area that the whole muscle feel really tight? Is it still a knot?
Could be a spasm.
Could be spasm. Knot usually is a relatively small. But you see where, yeah, but you see where terms can put you into trouble, yeah? Because if it's a big muscle, well, it might be a big knot, or it might be just tension in the muscle. So you never know. You never know what's under the skin. So we call it names, but really it's more the experiment that allow you to see, okay, well, I have this whole big knot in here, right? Do I use my thumb? Take me an hour, you know? Or you maybe start thinking, okay, well, forearm, static forearm, and then letting go. Or elbow, and then pressing and releasing, and pressing and releasing. At some times, maybe even knee.
It's a big bloke.
Yeah.
With a bodybuilder.
Yeah. If you can drop the table down and then you just do that. Okay, and then you're moving away into a different area.
Sure, you know knots. When we did knots, you said they were about the size of a pea. Can
Yeah.
you have more than one knot in one specific area? You can.
Should we stop for a second? Yeah? And then, do you want Okay. Let's say now I'm a real oil lover. Okay?
Thanks.
So, yes. So you put loads of oil. You think, wonderful, effleurage. Let's just, you know, oil it really nice and put so much oil, and then you're doing the petrissage. By the way, you think something is wrong now where the way I do it?
Your stance,
Yeah.
your posture.
Yeah, why? Why it's wrong?
You're
Not
leaning
letting
back.
it out.
You're leaning
Yes,
back.
why do I do it? Why?
And you
Terribly.
your back is
Because her hand interrupted me.
Oh.
So I would need to change it. Now I can come closer. I felt the hand interrupted me, so I couldn't have.
Trick question.
Okay. So now I'm start feeling right some tension. Let's say in here. So I do the petrissage. So I could keep doing it, but I decided, okay, it needs more of a deeper work. So first what I could do is take that and wipe the oil a little bit. Yeah. You don't have to do it, and if you have just a napkin, you can do it also. So, right, now in MTI, everybody would say, don't use your thumbs. Well, I would say you can use your thumbs, but don't only use your thumb. The thumbs is the easiest way to do a compression. Okay. So you can locate your body, and you need to bring your weight on top of it, and with it, put your pressure down. And let go. You can put it again.
So you don't have to do the breathing thing.
You could, yes, we'll see. And then you can do a little bit of movement around. So I feel that fiber of the muscle underneath. If you want to change, you can do a reinforced thumb. But again, there is a difference between that one and this one. So I have some support.
Just turned on my digestion. You poke that knot.
Really?
It
Good.
is. It really is.
Now, is it causing her stress? Should it cause her stress?
No.
Should it cause her a lot of pain?
No.
No. Is it activating the sympathetic nervous system? The fight or flight? It shouldn't. Yeah? Okay. Okay, so I can do that. I can do reinforced hand, or I can do reinforced in that way. That actually feel a lot easier because I don't need to press hard with my hands. There is a nice, so I do that pressing down. Yeah, good. I can do that with the fingers. Good. I can do that with a knuckle, like that, one finger knuckle. Now, if you do it with all of the finger knuckle, how do we call that? Petrissage. This is more petrissage because it's more moving the whole tissue. Yeah. In compression, you don't move it. You're poking almost like into it. Yeah. You're compressing into it. Yeah. You're compressing into it. Yeah. Petrissage is more moving it. So that would be petrissage. That would be effleurage. Again, petrissage. And start feeling, okay, well, we have that, and that is compression. Good. Now about breathing, depends where you are. If you want them to relax even further, you could work on that way, and it's quite important how do you say it. You could say, Lisa, I'm going to introduce a little bit of a deeper work. Let me know if it's painful. And I would like you to breathe in and slowly breathe out. And you're pressing more. And then breathe in. I'm still pressing in and breathe out. Good. And then you slowly release it. Okay? So, again, tell them what you're going to do. Don't involve anything like it's going to be painful or anything, because it will be painful. So to say, I'm going to introduce deeper work, breathe in, and then you can talk about what it does. Yeah. Okay. Now, other areas, yes, neck. So you actually need to go with it, with the body. So upper trapezius, you can do it here. Or you can do a reinforced. If I start doing that, it seems like a little bit more like petrissage, okay? So it's static. It's quite static. And you need to put your weight onto it. So here, you can see that the weight works because the knees bend. The moment that the knees bend, then it goes down. Yeah. So it can be used on the, even on the QL.
We were only taught one technique by the other guy who taught us.
About QL?
No, about the compression.
Oh, about compression. Okay. So here we are. You have a lot more.
Yeah.
Well, it's breathing when it comes to the thoracic. If you do it somewhere else.
That's the only place he taught us there.
So I'll show you a few more, but then after that we'll do a little bit more, okay? In terms of position, yeah? Okay? So this would be like a forearm compression. And then let go. Now it's interesting because I start feeling her movement while breathing. So I don't ask her to change her breathing, I just listen to. Good, okay. You can do that with the elbow. Is it compressed? So it's a compression. You can do that on the sacrum. So again, this would be more oscillation, isn't it? Yeah. What would that be?
Percussion.
Percussion, good.
Friction.
Friction, good. Rocking, vibration, yes? And
Compression.
compression.
Troy, where would you use elbow compression?
Sorry?
Where would you use elbow compression?
Thicker, bigger muscles.
Okay.
Yeah, thicker, bigger muscles. Here, maybe sometimes hamstring, and sometimes on bigger build-up people on that area. Shall we
Joel, one
try that?
question, sorry.
Yeah, yes.
On the legs,
Yes.
can you do that with the compression with
Yes,
your fingers?
yes, we'll do after. What I want now to more concentrate on the quality
Okay.
and the application. Thumb, reinforce this way. Knuckles, that knuckles. Forearms, a bit of elbow, with breathing, without breathing. After that, we'll do tour the body with gastroc, hamstring. Oh, how does it feel here? How does it feel here? Maybe not good. Yeah. How does it feel on the suboccipital area? How does it feel on different group of muscles? It should feel different. Sometimes it feels good, and I want you to start feeling it. And sometimes it feels great. Sometimes vulnerable. Yeah. Good. Let's start.